The question might sound humorous at first, but it's rooted in genuine curiosity and, for some, real-life experiences. The idea of a vagina whistling, making a high-pitched sound like a musical instrument, is something that has circulated in myths, jokes, and even in some personal anecdotes shared online. But is there any truth to the claim? Can your vagina really whistle? Or is this just another case of urban legend and misunderstanding? To answer this, it helps to start with a basic understanding of female anatomy and the mechanics of sound production. The vagina is a muscular canal that extends from the external genitals to the cervix of the uterus. It is lined with mucous membranes and is highly elastic, designed to accommodate everything from menstrual flow to childbirth. It is not, however, constructed as a wind instrument. Musical instruments, like whistles or flutes, produce sound when air is forced through a narrow passage, causing vibrations that result in audible tones. The human body, in certain circumstances, can create similar sounds. Think of how you can whistle with your lips, or how air escaping from the mouth or nose can produce a variety of noises. What about the vagina? Under typical circumstances, the vagina does not function in a way that would allow it to create a clear whistling sound. It doesn't have the rigid structures or narrow airways necessary to produce the vibration of air required for a true whistle. However, the body is complex, and sometimes unusual circumstances can lead to unexpected noises. One phenomenon that might be confused with whistling is known as vaginal flatulence, or queefing. This happens when air gets trapped in the vagina and is then released, often making a sound similar to passing gas from the anus. These sounds are usually more akin to a puff, squeak, or soft fart, rather than a musical whistle. The process is entirely natural, and it can happen during physical activities such as yoga, stretching, or sexual intercourse. Any situation where air might be pushed into the vagina and then expelled. Queefing is not a sign of poor health, nor is it something to be embarrassed about. It's simply physics. When air is pushed into a closed space and then escapes, it can create a noise. The shape and size of the vagina, how much air is present, and the speed at which it leaves all affect the kind of sound produced. However, the anatomy of the vagina and surrounding tissues does not usually allow for the sustained, tuneful sound that we associate with whistling. There have been rare and exceptional cases reported in medical literature where women experienced unusual sounds from the vaginal area that could be mistaken for a whistle. In these cases, there was almost always an underlying medical cause, most notably the presence of a fistula. A fistula is an abnormal connection between two parts of the body. For example, a rectovaginal fistula connects the rectum and the vagina, while a vesicovaginal fistula connects the bladder and the vagina. These rare but serious conditions can allow air or gas to pass from the digestive tract or bladder into the vagina, sometimes resulting in unexpected noises. In very rare instances, this could manifest as a sound that someone might describe as a whistle. However, these are medical conditions that require attention and treatment, not normal bodily functions. Another scenario in which a whistling sound might be heard involves the use of certain types of vaginal devices, such as menstrual cups or tampons. If air becomes trapped above or around the device and then escapes, it's possible for a brief, sharp sound to occur. Again, this is not a true whistle, but more of a squeak or pop. Still a far cry from the clear melodic sound a traditional whistle makes. It's also worth noting that the human mind is very good at interpreting sounds. Sometimes an unexpected noise can be misheard or misrepresented, especially if it's embarrassing or surprising. What one person describes as a whistle might sound to another like a squeak, a pop, or even a tiny honk. Our brains fill in the gaps, and stories can quickly take on a life of their own, especially when shared online or in social circles. So where does the myth of the whistling vagina come from? Like many urban legends, it's likely a combination of misunderstanding, exaggeration, and humor. The female body has long been a subject of curiosity and speculation, and because many people are uncomfortable discussing intimate bodily functions, myths can gain traction. Movies, TV shows, and comedy routines sometimes use the concept of a whistling vagina as a punchline, reinforcing the idea even though it is not grounded in scientific fact. It's important to address these myths with accurate information because misinformation can lead to unnecessary worry or embarrassment. If you experience persistent or unusual sounds from your vagina, especially if they are accompanied by other symptoms like pain, discharge, or a change in urinary or bowel habits, it's a good idea to consult a healthcare professional. While occasional noises are normal and usually harmless, ongoing symptoms could be a sign of an underlying condition that needs attention. The vagina is a remarkable part of the human body, capable of stretching, accommodating, and returning to its normal size. It is self-cleaning, regulated by a delicate balance of bacteria and natural secretions, and plays a vital role in sexual health, reproduction, and overall well-being. While it can make noises on occasion, just like other parts of the body, there's no scientific evidence to suggest that it can whistle in the way we typically understand the term. Celebrating body diversity and accepting the natural functions of our anatomy is a key part of sexual and reproductive health. Understanding what's normal and what's not helps to break down stigma and encourages open, honest conversations about our bodies. It's perfectly okay to laugh about awkward moments or to be curious about the things our bodies do, but it's equally important to seek out reliable information and not be misled by myths or exaggerations. In summary, the idea that your vagina can whistle is more fiction than fact. While the vagina can make a variety of noises, most commonly through the release of trapped air, these sounds are not true whistles. The structure and function of the vagina do not support the kind of airflow needed for whistling. Rare exceptions involving medical conditions exist, but these are outliers and should be addressed by a healthcare provider. If you ever find yourself concerned about any aspect of your reproductive health, remember that you're not alone and that medical professionals are there to help. Open dialogue, education, and a sense of humor can go a long way toward demystifying the body and promoting confidence and well-being. So the next time you hear the claim or see a meme about a whistling vagina, you can rest assured that while the body is capable of many surprising feats, this particular myth is just that, a myth thoroughly debunked.